Well, it looks like it's just another big W for being a man out here, because it looks like you can go ahead and push off the old finger in the bum just for a little bit longer. Prostate cancer treatment can wait for most men. That's fantastic. Just another, because, well, prostate cancer is exclusive to men. I know women don't have prostate. How bigoted. Yeah, I don't really care. But one of the largest and exclusive killers of men, we're actually finding some research and we're finding some technological advancements that's making the treatment a little bit more effective. I just consider that nothing but a W all the way around. So let's take a look at what we're looking at, because I don't know if it has anything to do with the old Moon River moment when you go to the doctor post 40, but this is a fun way to start off the video. Don't critique me too hard. Researchers have found long-term evidence that actively monitoring a localized prostate cancer is a safe alternative to immediate surgery or radiation. Fantastic. The results released Saturday are encouraging for men who want to avoid treatment-related sexual and incontinence problems, said Dr. Stacy Loeb, a woman, a prostate cancer specialist at NYU Langone Health, who is not involved in the research. Oh, great. So they just put a woman out there to talk about men's issues. How like life. Anyways, this study directly compared the three approaches: surgery to remove tumors, it's not a tumor, radiation treatment, and monitoring. Most prostate cancer grows slowly, so it can take many years to look at the disease's outcomes. Well, you don't obviously want it to just wait there so that the growth has an ability to metastasize. Obviously, you want to stay on it. Just rip that sucker out with that extended reacher that you can go. Anyways, there is no difference in prostate cancer mortality at 15 years between the groups. Hey, shut up. That's fantastic, Loeb said. Prostate cancer survival for all three groups was high, 97% regardless of treatment approach. And it's also very good news. I concur. The results were published Saturday in the New England Journal of Medicine and presented at a European Association of Urology conference in Milan, Italy. Britain's National Institute for Health and Care Research paid for the research. I don't care, man, who paid for it, as long as it's promising. Well, I guess because this is kind of controversial findings and it is just a repost from the Associated Press, so I guess understanding where the money comes from does make a little bit more sense. Anyways, men diagnosed with a localized prostate cancer. Why we got to get specific? Oh, right, because it's a repost from the Associated Press. That makes sense. Shouldn't panic or rush treatment decisions, said a lead author, Dr. Freddie Hamdi of the University of Oxford. Instead, they should consider carefully the possible benefits and harms caused by the treatment options. Yo, man. You want a real medical black pill? Take a look at how much money is generated by cancer research, and then come to the conclusion and start to realize that if that spigot gets turned off, how much money big pharma is going to be losing out if they can't market off of a research for cancer. That's why we're never going to have a safe and effective solution and a cure or a vaccine for cancer. It's just not going to happen. So that's why I promote staying healthy for as long as possible, to just try to dodge all of this stuff, like heart disease, dementia, anything that you can do to just make your golden years actually golden and not totally rusted out, so that you're just a disheveled corpse walking around being animated for a decade of absolute torture. Because big pharma, as much as they want to tell you that they're just going to ease you into your golden years, the later half of your life, the twilight of your life, they don't give a single care about you. I don't know you, and I care more for you. Just take a look at the content that I have on the channel. I want you to be as healthy for as long as possible, because nobody's coming to save you. You have to do the work yourself. That's why I'm kind of got a little bit of a side eye when it comes to this. It's like, do you actually care? Anyways, death from prostate cancer occurred at 3.1% for the active monitoring group, 2.2% in the surgery, and 2.9% in the radiation group. At 15 years, cancer had spread in 9.4% to the active monitoring group, 4.7% in the surgery group, 5% in the radiation group. Okay, so yeah, that's interesting. Interesting findings. It's just all increases over the years, but fairly passable, I guess. The study was started in 1999, and experts said today's monitoring practices are better, now with MRI imaging and gene tests guiding decisions. Well, that's great. We have more ways now to help catch that a disease is progressing before it spreads, Loeb said. Oh, good. In the United States, about 60% of low-risk patients choose monitoring. Well, yeah, of course. It's like, well, as long as it doesn't, go out of the way, I don't want to have to, drag around either a catheter or a colostomy bag, because that's a big bummer. No pun intended. So yeah, if we can work within the confines of this, if we can make it work, that'd be great. About 60% of low-risk patients choose monitoring, now called active surveillance. Yo, man, there's a George Carlin bit that was out there for... was that the... Because that would be funny if it was on No Cure for Cancer, or It's You're All Diseased. It was one of his final specials where he was talking about how language has been perverted. He's done this bit 1,000 different times, but the one that I seen most recently, where he just talks about he was using specifically PTSD, and the way that it started out is World War I veterans, they would suffer from shell shock, and then just the pussification of language over the years, how it's just mutated, and how many additional syllables hop on there, because what did it start out as? Yeah, surveillance. 2 syllables. 2 syllables on this one, and now it's active surveillance. Interesting. Now we got 4. Or no, it's 3 for monitoring. Monitoring. Or if I knew anything about syllables, I would know that it's both 4, but it just bifurcated and it became 2 words. So there you go. You got a different multiplication that's out there. All of this talk about cancer, maybe your boy's got a little bit of a brain tumor that he can't quite figure out his jokes in real time anymore. Anywho, Hamdi. Who's Hamdi? Oh my god, we're just throwing in different people here. Oh no, that's Freddie Hamdi. We already talked about him and I already forgot about it. A lot of meandering. Said the research had seen the differences in cancer spread at 10 years and expected it to make a difference in survival. Make a difference out there, man. Come on. Survival in 15 years, but it did not. He said the spread alone doesn't predict prostate cancer death. This is a new and interesting finding, useful for men when they make decisions about treatments. Yes, very much so. And the fact that there's actually some hope for a male-specific disease now, that's, you take the wins wherever you can find them. It's very, very difficult to come by. So, with all that said, thank you all very much for the gift of your time. I've been Don Consuelo. I want you to follow your gut and get after it. Take care, everyone.